call the Human Services Committee to order. Begin with the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
First item on the agenda is the Department of Social Services. Mr. O'Neill is not present today.
Good morning. I'm Swain Perrin. I'm the Deputy Commissioner. Mr. O'Neill requests this morning that the committee rescind resolution number 355 authorizing the budget amendment in the Department of Social Services contingent upon Medicaid reimbursement, increasing revenue appropriations in the amount of $80,000. Do I need to start over?
Sure.
Okay.
Go ahead.
Good morning. Mr. O'Neill requests that the committee rescind resolution number 355 authorizing a budget amendment in the Department of Social Services contingent on Medicaid reimbursement, increasing revenue and appropriations in the amount of $80,000 and North Country Home Services contract.
Motion to that effect. Mr. Monte, second. Mr. McNally, any questions or concerns concerning this resolution?
Yes. Why? The state actually came up with a solution for this. They provided the funding. I don't know how long it's supposed to last for, but they did agree to do that, so our funds are not necessary at this point. Good.
Thank you.
Any other questions? All those in favor signify by saying aye.
Aye.
Opposed? Carried. Any other concerns for the Department of Social Services?
I'd like to deliver a report if I may.
Go ahead.
In front of you, you have a package of information, and I'm not going to read it. I'm going to just add a little bit of information to it for you. One piece that's not in front of you that we learned as recently as last week is that each town supervisor is also the public health officer. We didn't know that. I'm sorry.
No, he's on the local board of health.
Okay.
And they name a public health officer.
Okay. Thank you for that clarification. The result of that is that any public health concerns that we may observe in the course of business, we are going to be notifying the town supervisors, usually via email or phone, and as soon as possible. Historically, we've tried to contact the codes enforcement officers, so we just wanted to let you know that's new. Some of you may have already gotten some notices. The first part of your report was the part that John was going to deliver, and only a couple of things that I'm going to highlight. Obviously, our mission and vision are out there, the scope of services, budget, all of that you can look at yourself. But one thing I do want to point out is under Child Protective Services, the mandated hotline number. And I would remind you that if you have a concern for a child in a family or a household in your community, that you use that number. And that will generate a report through the State Central Register that will allow us to investigate it and perhaps get some services involved. And the other part that I would like to share with you is the contact information. As you're aware, John is planning to retire, and I don't want to leave you without any contact information. So until a new commissioner is hired, you are welcome to give me a call at 873-3416 at any time. He has visit anytime. I would welcome that. You don't need an appointment. I just hope that I'm there so that I can introduce you and show you around. You have access to badges through the county manager, the attorney, and the board clerk. And if you're interested in any town presentations, obviously John is not going to be available, but I would be happy to do that for you. You have my number and you're welcome to give me a call. Behind that is the updated organizational chart that I would just like to point out to you so that you can see an overview of how our department looks and the structure of it. And then as you move on, you will get to the Human Services Committee report, January 9th, 2017. I will tell you that a couple of months ago, I was speaking to our employees, and I said to them, what would you like for the board to know? And this is what they came up with and what they developed with me to be able to share with you, and we hope that you find it helpful. A couple of things that I would like to point out is that under CPS, the data, the 670 reports this year, represents raw data. It doesn't incorporate subsequents and duplicates. So if a duplicate report comes in on the same incident, we just investigate the same report, or a subsequent on a family, we can often merge those reports. So that's just raw data coming through the State Central Register for 2016. Statewide, approximately 70% of reports are unfounded. One of the issues that we're currently facing is that CPS often takes up to 10 weeks to train, and that's been an issue at the state level. The training is not offered as often as we need it. So one of the things that we've been doing is not hiring until we know that we can get that worker into the training. They can't do any work until they've had the training. So there's no point in hiring someone to sit at a desk and really do nothing until that training is available to them. So we've been trying to schedule that accordingly. I just wanted to let you know that we've been trying to save money by doing that. And the total number of reports are up from 628 in 2015. And as usual, we're operating on a string, a very small number, a skeleton crew of Child Protective Services workers, because it is a place of high turnover, and we have some medical issues and pregnancies and things like that. So I think that our team does a really great job of helping each other and working through some of those issues. Under preventive services are those supportive and rehabilitative services that reduce the risk of placement. The numbers that you're looking at are low. Previous years have seen around 60 families being served at any given point. Low numbers allow us to assist in other units and to work more intensively with the cases that we have. I just put in my own notes that a reminder that one residential foster care placement can cost between $120,000 and $140,000 a year. And the Youth Advocate Program currently serves, although they serve 14, the number that I have, 4 of those are 0 to 5. So I took the 10 and then multiplied it, so the cost savings is approximately $1,200,000. Adult services. One of the things that I want you to know is that several years ago, we recognized that the caseloads were increasing and that we were going to have to be asking for an additional staff member. And it was about the same time that state Medicaid started taking over a lot of our work, or said they were going to. So we started anticipating that. And in doing that, one of our coordinated care workers, we thought she was going to lose approximately 40% of her caseload. So rather than asking for a new staff at that time, we came up with a plan to gradually, over the course of 2 years, transition her into that adult protective caseworker position rather than asking for an additional staff person. And that's where we are with that caseworker right now. She's actually doing about a quarter of her work is in the coordinated care unit, and 3/4 of her work is in the adult protective services unit. On the next page, fraud investigation, the one thing that I would add is that investigators are actively interfacing with clients, which has resulted in an increase in the number of active signed repayment agreements, which is really good news. People are actually coming to them, sitting down at the table with them, and coming up with arrangements for repayment, rather than having to take them to court or to pursue it in any other fashion. I would like to highlight child support. $3,189,113 in total revenues in 2016. That's phenomenal. A lot of work for a very small unit. The Christmas program. There's a brief piece of that in your folder, but I wanted to let you know how much it's grown and how big it actually has become. In 1987, the Commissioner's Children's Fund, now the Emergency Fund, was the only resource that we had to serve our clients for Christmas. So each caseworker, which included me at the time, was allowed to spend $10 on each child on their caseload. We could go to Kmart or Walmart or whatever store and spend $10 on each child, and often that meant mittens, hats, boots, needs, not toys or fun things. That was the first year I was actually approached by a private family who said, we'd like to sponsor a family, and we were able to do that. Well, the idea really caught on, and that program has grown immensely over the years, and it's gotten so big that it requires many people to coordinate and to make it happen. So, the act of generosity was inspiring to others, and over the years, and the idea caught on with more private families, businesses, organizations contacting us to sponsor families or make donations of toys, money, and even time to assist in the wrapping before delivery. So each year, we place 2 Christmas trees around the county and put ornaments on them, and county employees or their families or anyone walking through these buildings is able to pick an ornament and sponsor a family. And they deliver this information, they deliver the products back to us, and we deliver them to the families anonymously. While the initiative was actually intended to have the public become more involved, it actually took off with the employees, and most of those ornaments are now taken and the items are purchased by the employees for our kids. And it's rare that they're not picked up quickly. So, additionally, employees have worked with the U.S. Marine Corps to make sure that the children also receive toys from the passing Marine train. Excess toys, always new, are then brought back to the department and distributed. So what I'd like you to know about this is, and I'm sorry if I'm kind of reading from my notes, but I don't want to miss anything. It's really important. This program is truly a team effort and requires many hands. Without the dedication, hard work, and coordination efforts of Sherry Reynolds and the help of Mary Stanley, Tammy and Courtney Christian, Chantel Cross, Amy Catanzarita, and Phyllis Martin, to name only a few, this program would not be nearly as successful as it has been over the years. I'd like to publicly thank them all, as well as all of those who donated, picked up, delivered, bagged, loaded, supplemented, and gave of their own time to make this happen. So, attached to this report is also some information, I'm not sure if it's all, but broken down by town. So hopefully, if yours is in the same order that mine is, you have 2016 Child Protective Services reports by town, year-end foster care report by town, a list of daycare breakdown, preventive services breakdown, and temporary assistance, SNAP, and HEAP. Should all be there as well. And finally, on the back, I just wanted to share with you some positive stuff. And there are 2 thank yous from one, a client who was a recipient of the Christmas program, and the thank you that was sent out to all of our staff, thanking them for their incredible generosity. So, I hope that I've covered everything. I understand that my time is very limited, so what I would ask is that in your leisure time, which we all have so much of, you take a look at this report, and if you have any questions that are not answered today, that you feel free to call me anytime with your questions, and if I don't have an answer, I will work to try to find one for you.
Thank you very much for that report. It's very informative, and it's materials that our supervisors will be able to digest later on. Any other questions or concerns? Yes, Mr. McNally.
Yes. Do you see an increase or decrease with the amount of people requiring services as our population ages, but also our population declines? Do we have a graph the last 5 years of how many people have applied for SNAP and HEAP? Are these numbers going up or going down?
For SNAP stuff, do you have an answer? Do you know the answer?
I think going forward, you should have some history available so that we can see what the trend's going, and I'd like to see that if possible.
That's very helpful, great. I actually welcome an understanding of what you're looking for and what would be most helpful for you, so we'll...
Great, thank you.
Mr. Preston, you had a question?
Actually, I have three. Child Protective Services, how do those come in? Is that the neighbor?
It can't be anyone. Anyone who suspects child abuse or maltreatment can make that call. We only have authority to act if that call is made through the state central register. So that it has to go through Albany and then come back to us. There's also a group of mandated reporters that are outlined by legislation, which are teachers, doctors, a whole group of professionals that, therapists, if they suspect, they have to call it, and there's a separate line for them as well.
Well, I just find it very interesting. There's 674 reports for the year. I mean, granted, maybe it looks like, over 50%. Really, they're unfounded or undetermined, but that's a large number, I think.
Oh, it is. It absolutely is. Undetermined means that it's currently open,
right,
and the case has not been determined yet.
Okay, under preventive services, it says 35 year-to-date referrals. Where did the referrals come from?
The referrals come from Child Protective, from the community, from schools, probation. A lot of our referrals come from probation. We work very closely with them, particularly on the PINS kids. The families often refer themselves. So.
Okay, and same question, adult services? It says year-to-date referrals 92. Again, they come from the...
They can come from the community. There is no mandated line on that.
Mm-hmm.
That might be someone who sees something going on, who suspects that the adult might be taken advantage, be being taken advantage of,
okay,
either financially or in other ways.
Thank you.
You're welcome.
Other questions or concerns? Yes, Mr. Scozzafano.
Very good reporter.
Thank you.
Back on the town boards being the Board of Health and so on, you and I have had this discussion. I've had it numerous times with Mr. O'Neill. One of the problems that I see in my community is that we have a local law that says before any landlord can rent out an apartment, if that apartment is vacated, they're supposed to have a certificate of occupancy prior to someone moving in. So we in the Village of Port Henry also has that law in the books, which John O'Neill has a copy of that law. But for whatever reason, social services, who rents the apartments and pays the landlord directly, never contacts our code enforcement officer. So, in regards to preventive, if you could catch this up front, it certainly would save a lot of issues down the road. So I've been told numerous times, although I've never seen the statute, I've never seen the law, that social services isn't allowed to do that. So I would like for someone to please show me where it is written that social services is not allowed to follow an ordinance or a local law that has been set in the community.
I will try to find that for you.
Thank you.
Well, this has been an ongoing concern with the Board of Supervisors. And we have never received a solid answer.
Okay.
Just to carry on this. Some of the properties in tax sales, this has become a cycle in different parts of my community where landlords, most of them absentee, come into the area, buy these places for back taxes, never pay a water bill, a sewer bill, never pay any taxes. They go right back into the tax sale, and the whole time they're deriving income, many of them, through social services. So they're getting
they're really getting the bang for the buck. Because they're not paying anything towards services, and the county's getting nailed twice. So we really need to try and get a handle on this. It's not complicated. One call to the code enforcement office, we're looking at such and such an apartment, could you have your code enforcement officer go in and do an inspection and see if there's a certificate of occupancy can be issued?
I recognize the issue and understand where you're coming from. I will tell you that in the short amount of time that I've been looking into this, one of the answers that I do get, and I do recognize that the legislation and the regulation is important, and I will continue to look for that for you, is that if we have the codes enforcement inspect one apartment and then someone moves into it, the confidentiality is breached.
I don't buy that for a minute, because I rented apartments myself, and one was, it was subsidized through HUD. Let me tell you what, they came there and they do a complete inspection of that apartment.
They do.
Yet we are putting people that are in our care into apartments that nobody's even looked at. And I can tell you, I've been in some of these places, and we've shut some of them down. And it's a real issue, and I think the situation in Willsboro is really pointed out, and I understand that was a private home, not an apartment, but still there's a relation there. That, we got to keep a better eye on a lot of these things, or we're going to have some real catastrophic things happening in this county.
My hope is that the department will be able to, in the future, work with the board in partnership in a way that is mutually agreeable, that meets both of our needs and requirements.
Thank you.
Other questions and concerns? Mr. Preston.
I just want to chime in that we did have a meeting last Thursday with social services, and I am going to find out who is it. These are regulations that are supposedly put forth from somebody in Albany, and I'm going to find out who that somebody is. I already made a phone call on Thursday afternoon in regards to if a certain individual can get me some phone numbers, because again, I'll be honest, Tom, I agree with you. It's a common sense thing. What is so difficult about having an inspection of an apartment before somebody goes in, whether it be HUD or whatever? And again, Sue Ann, I'm not blaming social services. I'm just saying if that is in fact a regulation, then we ought to be able to come out with a regulation that can fix it, because to me it's really common sense, and I am going to follow up on this and try to find out who it is in Albany that we need to be speaking with. So,
I'd be happy to work with you on that.
thank you.
It appears to me that you have some assignments.
I do.
In clarifying these issues, and we look forward to some answers in regards to that.
I will do my best.
Other concerns? Yes, Mr. Marnell.
Considering all the millions of dollars that we spend for substandard rentals, have we ever researched buildings?
I'm sorry.
Building housing in different areas? I mean, I know in School Lake there's 10 places that they're paying, for they're substandard.
To my knowledge, we have not. Trying to... In looking at I think what I'd like to research and to look more closely at is how many of the housing. I think there's a general thought that we're paying rent for many people, and I think I would like actual numbers for how many people we're paying rent for, because I'm wondering if it really is many or if it's a few, and I don't have the answer to that. But and the answer to your question is, to my knowledge, we have not researched that.
Other concerns? Yes, Mr. Murphy.
First off, Sue Ann, I want to thank you for that report. It's probably the best report I've seen out of social services since I've been on the Board of Supervisors. But I agree with Mr. Skozafav and Mr. Preston. When you put a family in an apartment, the contract is with who? If social services places a family in an apartment, that contract is with you and with social services and the
Client. The client comes in, we actually don't have the ability to tell them they cannot live there.
So that, it's between you and the client. But again, I think there's got to be a regulation where we shouldn't be putting clients, if we're looking out for the safety of the client, putting them in substandard housing should,
I don't
regardless.
disagree with your concern. I think that it's going to require some time and attention to be able to, one, figure out where that regulation currently exists, and I don't think it's going to happen overnight, but I'm willing to partner with whoever's working on that to see what we can figure out.
Thank you.
You're welcome.
Yes. Mr. Moore?
Just to clarify that, does a check go from Social Services Department to the landlord or from the client to the landlord?
Steph?
It goes directly to the landlord. The client does have the option of giving the money directly to the client or to the landlord.
Right.
We have opted to make it directly to the landlord, thus you're saying would be a chance of the rent not being paid on eviction and causing more relocation.
So that's what I meant. That's what I wanted clarified. It doesn't go from the client, it goes from the Social Services to the landlord. So Social Services, and I know Randy's going to check this out down in Albany, but as far as breach of confidentiality, Social Services can go down and look at it, like Tom says, not the client. You don't even have to give the name of the client who's going to go there. That's irrelevant who's going to rent it. It's Social Services renting it. So the client doesn't even have to be involved in this.
I can tell you that in preventive services and in children's services, if the client is willing to allow us to do that, then we do and we can. But in temporary assistance, we don't have the ability to do that.
Well, the client shouldn't have any say over it since Social Services is paying for it. But that's here and there. I just wanted to clarify that point.
The way
And I
it
just
is
want to say, I want to go one step up on Jim. I've been here a lot longer than Jim, and this has been the best report I've ever seen. This has been, like myself and Tom, this has been probably the best report I've ever seen in my tenure of being here.
Oh,
I
thank
thank
you.
you for that. And also, I want you to, if you would, please, I want to thank the social service employees because there was a problem in December. You mentioned the toys with the Marines and things. The Toys for Tots, for as long as I can remember, come into Port Kent Station. And this year, Social Services was not going to go send the letters out. There's over 300 or 400 letters that go out to families, and they weren't going to do it for some reason. But yourself and your workers over there did take the task on, and we appreciate that. Otherwise, we took care of over 300 children in our Knights of Columbus building, handing out toys, and they got them off the train. And that would have been a disaster for those needy kids not to get toys, and you pulled it off, and I want to thank you for that.
Thank you very much. Thank you.
Any other questions to that? Thank you very much for all of your information, and I do realize that you were on the hot seat this morning, and you carried yourself very well.
Thank you very much.
Mental health.
Morning. I'd like to start out with the resolution that we increase appropriations to turn the heat up in here.
Not this year.
Maybe next year. Budget's gone through? Okay.
How soon you forget? Last week it was too hot.
Okay, so I actually have a number of resolutions, primarily a lot of them related to budget. Most of them are associated with the DSRIP, which is a Delivery System Reform Incentive Payment Program that's been in operation for a couple of years, and also a lot of them related to our search for psychiatrist at the clinic. I have a couple of sheets that have been passed out. One just today that came out separately. I put on your desk in front of you January 5th. So I want to start with that one if we could. So the first one is a a resolution authorizing increase in 2017 revenue for the Mental Health Department, account 43489 DISRIP, in the amount of $60,540.25 to reflect deferred revenue from 2016 to 2017, and to increase appropriations to account group 43204, account number 43489 DISRIP, in the amount of $60,540.25, same amount. So this is to carry over unspent funds that were unexpectedly granted to the Mental Health Department in late 2016 by AHI. And so in 2017, in the coming months, we'll develop a spending plan for those funds, which must be in support of projects included in the DISRIP initiative. So they have a certain menu of projects, and we'll spend that money in support of those projects.
And endorsement of that resolution, Mr. Scott's-Father, and the second by Mr. Merrihew. Any questions or concerns, clarifications? Mr. Scott's-Father.
Delivery system reform incentive payments. So it's primarily about Medicaid and reform.
Crosses over all the human services departments, mental health, public health, all of them.
Yeah.
Any other questions? All those in favor signify by saying aye.
Aye.
Opposed? Carried. Next resolution.
Okay, so this is a resolution authorizing an increase in 2017 revenue for the Mental Health Department, account 43489 DISRIP, in the amount of $27,000, and to increase appropriations for account group 43204, account number 43489 DISRIP, in the amount of $27,000. So this is an award that I just heard about last week. I just learned that we have received from AHI a DISRIP award in their recruitment and retention fund. And so this will allow us to accept that award to be used to support the hiring of our psychiatrist by offering reimbursement for interview and relocation expenses, and also a retention bonus. And I talked to Dan and Dan about this morning, and the county attorney says that this should be pending authorization of an execution of a contract by the county. Just as I said, I just learned that we've been approved for these funds. I want to get the board's approval to move forward, and of course we would make sure that we have a contract in place to support that and pay those funds.
In endorsement of this resolution, Mr. Scott's-Father, and second by Mr. Monte. Any questions or concerns, clarifications?
I'll just clarify. Again, this is, typically in the public sector, we don't offer bonuses or anything like that, but this is 100% funding. It's specifically designed to entice that psychiatrist to stay more than 1 year or for a few months like we've been running into. What this does is provides that we would offer a bonus of $10,000 the first year, and then a bonus for
Another $10,000 bonus after the second year. And then also some moving and expenses and some travel expenses for interviewing.
So if we were trying to do this with county funds, it would not be, and we wouldn't allow it, but typically because this funding is 100% reimbursed, that both Dan and I feel it's okay to go ahead, provided that we have a contract with the individual that's hired that specifically says it's okay, in that in order to pay it out, he's got to stay that long.
Yeah, and also a contract with AHI that when we commit to pay that money, that they will reimburse us for it. Because that's kind of the way that works. It's been approved, but once you have documented expenses for moving, et cetera, then we would be able to reimburse for that and then get reimbursed by AHI. Same thing with the with the retention bonus. We would pay the person, but then we would have to get reimbursed for it. So we'll make sure that we have a contract in place that we're not at risk.
It's a recruitment tool that typically we would not have advantage to use, but because of this funding through DESREP, we would be able to offer it. Getting a psychiatrist has been a nightmare over the last 5 years, 6 years, I don't know, it goes way back to Nikki. But this may help us in that. So.
Any other clarifications needed? All those in favor signify by saying aye. Aye. Opposed? Carried.
Thank you. So I've got a resolution authorizing increase in 2017 revenue for the Mental Health Department, account number 4162071 in the amount of $21,696. This is to reflect additional safety net funding from the state, from New York State, to compensate community mental health clinics for service visits provided to uninsured county residents who we bill on a sliding scale fee that does not cover our costs to provide the professional service and is far below reimbursement from Medicaid or other insurance. So this is a funding program that's been in place for a number of years. It used to be called uncompensated care, but that has been restructured due to a glitch in Albany. We actually went about a year without any of this funding, so now it's been reinstated under a new formula, and they're calling it Safety Net. And so it's just extra revenue that we're going to be able to get going forward.
Any questions or concerns? An endorsement of this resolution? Mr. Mayor, a second. Mr. Scotspower. Questions or concerns? All those in favor signify by saying aye. Aye. Opposed? Carried.
Okay, so now I'm moving to the other sheet dated December 28th that was in the full packet that was in front of you. First one is a resolution authorizing the increase in the salary for the part-time staff psychiatrist from $109 per hour to $170 per hour, with the total expenditures for this position to be monitored and capped at the amount that can be supported by funds that are already in the 2017 mental health budget for the full-time staff psychiatrist position. In other words, right now we're still without a full-time staff psychiatrist. I've been working with the purchasing department on the RFP to sign a contract with a recruiting firm. We're probably days, maybe even hours away from selecting the firm to do that. So this is going to allow us to keep our part-time staff psychiatrist on board to cover the gap, and is really bringing that wage up to more of the market value. Also, the $109 figure does not include fringe benefits, which are not paid on the $170 an hour. It's a non-benefit position at part-time.
An endorsement of this resolution? Mr. Gilliland, and a second. By Mr. Scotspower. Questions or concerns?
I guess the only question I would have, Steve, is typically what are you using him right now per week? I mean, I guess I'm wondering how long this is going to carry us, because that's a fairly significant.
We're using him about 2 days per week, and actually he's been on a vacation, if you will, or on a leave for about a month.
Okay.
He'll be back in another couple of weeks.
Okay. All right. So worst case scenario, we should at least get his part-time services throughout the 17, and it turned out that we couldn't recruit somebody.
If we didn't recruit, yes. So we would monitor that in terms of, we've approved in the 2017 budget for a full-time position. So obviously,
We're going to stay within that.
every week that we don't have somebody, we've got a full-time position that we're not incurring expenses, and we'll be paying the part-time psychiatrist for 2 days at this rate.
Other concerns? Yes.
Is this psychiatrist available to the Board of Supervisors? If so, we better support it.
That would, well, so we would need how many hours per week?
Now we have to double charge.
Mr. Mayor,
Steve, I was curious, do we work with like Franklin County, Clinton County, do they have full-time psychiatrists, or are they also a part-time based county?
Well, I'm not sure exactly what they have now. I think it's a mixture, I would say. Clinton County, they have a county-run clinic. I'm trying to remember exactly what they have now. I know that they have had full-time in the past. Many of the county clinics are using nurse practitioners, psychiatric nurse practitioners, along with a psychiatrist. Clinton County also has a private entity, Behavioral Health Systems North. They have, I think, a couple of psychiatrists up there. Again, I'm not exactly certain the full-time equivalency of that they have. Everybody's scrambling in that regard.
further questions? Yes, Mr. Orton.
If we hire a full-time psychiatrist, we're fortunate enough to find one, but for some reason we end up needing a part-time psychiatrist, does he get paid $109 or the $170?
Be recruited at the normal rate, right?
He would, well, as it stands now, he would be 170, but...
He'd be 170.
But I'm not, what I'm asking for, and you can word this any way you like, is that it has to be supported by the funds in the budget. We're not going to go over that cap. So
Basically, what we're saying is regardless whether he's full-time or part-time, he's going to be paid $170 an hour.
No. The full-time person is not going to be paid $170 an hour.
He would be paid $109, the normal rate.
Okay.
I'm sorry, I misunderstood your question.
So if we hired a full-time psychiatrist, it would go back to that budgeted rate of $109 an hour, which is
What is that budgeted amount for the year and then?
about $195,000 a year, somewhere in that area for salary.
Other questions?
Is that plus?
That's benefits. Benefits would be on top of the hourly rate.
Yeah,
Those in favor signify by saying aye. Opposed? Carried. Next resolution.
okay.
It is a lot of money, but the ironic part is you can't find somebody to take it. I mean, that's the problem.
So, moving along here, resolution authorizing Essex County Purchasing Department to release an RFP for telepsychiatry services for the Essex County Mental Health Clinic and to award a contract in accordance with Essex County Recruitment Purchasing Policy, providing that the amount of the contract does not exceed an amount that can be supported by the total salary and fringe that is currently budgeted for the full-time staff psychiatrist. Okay, so this is kind of part two of the the resolution we just got done talking about. I'm in the process of trying to put together what kind of a plan can we put in place to cover the need in the county. We could probably employ 2 full-time psychiatrists and keep them busy. Not even counting the Board of Supervisors. As I look at this whole process, and I think back to 2014 where we went 11 months without a doctor, we used telepsychiatry at that time. And so there are a number of opportunities that have come up from a couple of different sources that have outreached to me. And so there's a possibility of recruiting with, or contracting with one or more of these firms to, again, maybe provide some part-time telepsychiatry coverage. My thinking is that this telepsychiatry, we can debate whether what's better, in-person telepsychiatry, but the question is what's available to us. And as I'm thinking about this psychiatrist position going forward, maybe we don't end up with a full-time psychiatrist. I don't know. It's going to really depend how that recruiting process goes. But my idea is to keep this within the budget that we currently have, and maybe we don't put all our eggs in one basket, so that we're not in this position of having a full-time person that walks out the door every couple of years, and then we're trying to scramble around and figure it out. So if we can come up with a plan to go in maybe several different directions and have several different providers that are in place, maybe a part-time psychiatrist on site, part-time telepsychiatry, maybe including that psychiatric nurse practitioner. That's kind of the vision that I have at this point. So again, this resolution would fit into that, and like the first one, would be within the boundaries of that budgeted amount that we have for that position right now, which, as Dan says, is $195 in salary plus fringe. I think it puts it up close to $300,000 yeah, up in the mid to upper 200,000s anyway. So that's my thinking on this, and that's what I'm proposing.
It's very evident that you are exploring all the avenues that we may have to take in order to provide psychiatric service. The endorsement of this resolution by Mr. Mayhew, and the second by Mr. Giordano. Questions or concerns? All those in favor signify by saying aye. Aye. Opposed? Carried.
Okay, a resolution authorizing awarding a sole provider contract with Locum Interactive Incorporated, One Path Careers Incorporated for psychiatric examinations, treatment planning, and court testimony related to assisted outpatient treatment proceedings. The contract, like the other two, will not exceed the amount of $14,000. No, it's not like the other two, I'm sorry. The contract will not exceed the amount of $14,000 and is fully supported by funds that are already in the 2017 mental health budget for consulting fees. Okay, so AOT, for your information, assisted outpatient treatment, is really an involuntary process to provide involuntary treatment to folks on an outpatient basis, so they're not in the hospital, but it involves a very specific type of evaluation. Our county attorney has to be involved with the whole proceedings. We actually have to go into court and provide expert testimony why this person meets the requirements for the law, why they need to be on assisted outpatient treatment. Typically, the whole purpose behind enactment of this law 10 years ago was all around public safety. This organization, this company, provided a psychiatrist for us to do our AOT evaluations back in 2014 when we didn't have a psychiatrist. They do a fantastic job, and again, this would be in the scenario that we do not find somebody to come in and work for us that can do these. Normally our regular staff psychiatrist does these. Somebody that can do these and we need to have somebody complete those evaluations and attend the court hearings and so on and so forth. If we hire somebody, then we do not, there's no reason for us to do this, but we really need to get the contract in place. We have a couple, these are annual code orders, so they have to be renewed every year. We have 3 people currently on AOT orders, and I think the next one that's coming up for renewal is in May. So I just want to get this in place in case we don't have somebody at that time.
In endorsement of this resolution, Mr. Gilliland, yes. Second, Mr. Mayor. Any questions or concerns? All those in favor signify by saying aye. Aye. Opposed? Carried.
Okay, it's definitely warming up in here now. Resolution authorizing payment of $5,000 to the New York State Conference of Mental Hygiene Directors for consulting and financial advisory services to develop a proposal for the formation and implementation of a regional provider network of county mental health service providers. Any questions? This expense is to be fully supported by revenue and expenses that are already in the 2017 mental health budget as a result of the DSRIP funding from the Adirondack Health Institute. That $60,000 that we just carried forward, 5,000 of that is going to go to this. So I can answer questions about this because I'm not sure I even understand what this is about.
In endorsement of this resolution, Mr. McGowan, second by Mr. Marion. Questions or concerns, Mr. Marion?
That would be, so it's the actual conference who's going to develop the program, and then we're sort of allied with them, so there'll be a lot of mental health directors like yourself. Will you be participating directly with that?
I have been involved with the development of this plan as it's going forward, something that we in the statewide conference have been talking about for probably about a year now. This is related to the Medicaid transformation and the advent of Medicaid managed care into the mental health system and move toward something they're calling value-based payments. And essentially what they're doing is putting providers, they're saying that providers need to be in large enough networks so that you have enough covered lives in your network to make it worthwhile to contract with a managed care company. Right? So there's been a lot of work that's going on right now in the North Country with hospitals, primary care, mental health providers, substance abuse providers who are forming together and are going to be getting involved with these networks. The issue that we have as a county-run clinic is that there are legal restrictions about us entering into those kinds of contracts with other non-government entities. So the plan will be then for all of us county mental health services, county-operated mental health services statewide. They're calling it regional, but my understanding is we could be in a group with people from Buffalo, with counties from Buffalo or down by the city, but it's going to be a network of county providers. So this $5,000, the state conference is going to contract with the consultant to kind of put the plan together in terms of what would this look like going forward for the county. And at that point we would have a proposal in terms of a contract, what that's going to cost us going forward, what would be the cost-benefit ratio. But all the counties that are interested are being asked to put $5,000 to go to the conference, then they can contract with this consultant to put forward that plan.
this is really Medicaid's plan to really transition all human service agencies from fee-for-service to managed care. Managed care is really something paid for by insurance companies as opposed to direct fees for services rendered. So that's really what the intent is for all of these programs. You're going to see it across all of the human service agencies as you move forward. That was the discussion you just had recently at DSS as it relates to those level 1 and level 2 services. Level 2 is managed care, level 1 is fee-for-services, but they really are changing that model in terms of saving money under Medicare or Medicaid.
This resolution has been moved and seconded, and there has been plenty of clarifications. Any other questions or concerns before voting on this resolution? All those in favor signify by saying aye. Opposed? Carried.
Okay, I'm all finished, and I thank you all for hanging in there with some pretty tedious stuff. Tried to liven it up with the humor.
Thank you. Public Health, Linda Beers. Hopefully you won't take the same amount of time.
I will not. My first resolution is to increase my principal account clerk by 2 hours. She's at 37.5, and I'd like to make her 40 hours. I came to that with this resolution in October. During that time, you asked me to meet with Workforce Committee, Salary Committee, and I have done so and have been approved by Sean Gilliland to move forward with this as a resolution. So that's what I'm asking for today.
A motion to this effect. Mr. Gilliland, the second. Mr. Marion. Any questions, Mr. Marion?
I guess the first question would be, as you explained, she's assuming other responsibilities with prevention, WIC, early intervention, preschool.
Right.
Was the Vineski firm doing those services prior to that? So those were not being done?
Vineski was hired for public health downstairs, just prevention. WIC, early intervention, and the CHA have taken up much more time than, and not overseen by Vineski Group, the V Group, yes. And as you've all been mentioning, the CHA's Certified Home Health Agency is also struggling and changing over from what's called fee-for-service to value-based payment, which is a huge amount of data collection and whatnot to show where we stand now to where we're moving. So all of these things are based on population health, and billing will change as we know it, and if we're behind the curve on that, we won't bill successfully, and we will cost money to the taxpayers. So that increase equally of 2 hours a day supports all of the new training that's going to be required to go to value-based payment.
Other concerns? All those in favor signify by saying aye. Aye. Opposed? Carried. Next resolution.
So the other resolution, you just heard Steve do it. I think you're going to hear Christy say it as well. We equally got DSRIP funds. So I just want to clarify, I'm going to give it 2 seconds. DSRIP funds are for Medicaid reduction of hospitalization by 25%. If you remember anything, that's all you need to remember. Everything that we're doing is to help reduce the Medicaid readmission rate to hospitals. That's been found to be the highest cost to government and to county and to health care. So all the initiatives we're putting in place are to reduce readmissions to the hospital from the public health point of view, from mental health, and from aging. The New York State has been divided into regions. Our region is being Warren, Washington, Clinton, Essex, Franklin, and St. Lawrence County. We all fall under AHI, which is the Adirondack Health Institute. The Adirondack Health Institute has been given lots and lots of money to support us in changing that. I was awarded $22,100. It's called engagement funds because I've sit on several of their committees, and because of our efforts in moving those initiatives forward, they're rewarding us with this grant money. And we will equally do initiatives. I don't have any earmarked right now as well, but we'll be using that money to reduce readmission rates to the hospital. So,
A motion to this effect. Mr. Gilliland. second, Mr. Scarpata. Questions or concerns? There being none, all those in favor signify by saying aye. Aye. Opposed? Carried. Any other questions for Linda? Thank you very much.
Thank you.
Office for the Aging, Chrissy Lokes.
Good morning. I have two resolutions. The first is a resolution for a budget amendment to bring forth $4,000 of DSRIP money from 2016 to 2017.
A resolution to this effect, Mr. Scarpata, and the second, please, Mr. McNally. Questions or concerns? There being none, all those in favor signify by saying aye. Aye. Opposed? Carried. Next resolution.
Next is to accept $18,100 from DSRIP funding, like Linda and Steve just mentioned, and then obviously to increase revenue and appropriations for that same amount, please.
A resolution by Mr. Guerrero, a second by Mr. Scarpata. Questions or concerns? There being none, all those in favor signify by saying aye. Aye. Opposed? Carried.
No?
Yes.
Just for new supervisors, well, especially Mr. Wilson, around this time of the year, you'll see lots of resolutions that move state funding forward from 2016 into 2017, and that's really based upon the fact that we have a different fiscal year than the state. So their fiscal year extends into March of, the end of March of 2017, and ours is in January. So you will see a number of these resolutions proceeding over the next few months where money is moved from 16 to 17 for that reason.
Any other questions for Chrissy?
I do have just one other kind of comment. Many of you did meet with the advisory council, I believe, back in November, and many did mention that they would like to be included in those regular meetings, which are normally every other month. Elizabeth Weiss, the chairperson, did inform me that she notified many of you by email. Some emails were kicked back to her, but she will be reaching out. The next meeting, just for your information, is January 19th at 10 o'clock at ACAP, Adirondack Community Action Program, located over here next to Obashan in their conference room. That meeting is obviously open to everybody, and if you have any questions prior to that, please feel free to reach out.
The time on that again?
10 o'clock.
10 o'clock. Any other questions for Chrissy?
Thank you.
Transportation, Nancy Dugan.
Good morning. I don't have any resolutions today. I do want to let you know, for the first time in a few years, our volunteer funding, we haven't had to come to you. We had $9.77 left, rather than asking for $4,000 or $5,000 more. This year, the Mountain Valley is already 500 passengers ahead of last year for December, so it's looking like it might be a good year there. I may have a resolution coming before the end of the month for GPS units. I'm working with Dan. The actual cost of them is $4,996, and then the annual fee is around $5,000, but that does include an app for the rider to be able to find out when their bus will be arriving. I've been working with Lake Placid, and we'll be on this for quite a while, so it's finally coming through, and there is 5311 money for that, which is 90%. And then I will have one for increased revenues when I have a better idea on the amount of it.
Thank you very much. Any questions for Nancy?
Thank you.
Very much. There being no further actions in regards to the Human Services, we are adjourned.